So our mission is a simple one. It's to increase the impact of recovery in our communities through education, advocacy, and training. So that means we try to lift up and talk about recovery and recovery supports that are benefiting communities, because our field has a long tradition of people in recovery not speaking out. And we think it's really important for advocacy efforts, for visibility, that we all speak out, and more importantly, that we speak out with one voice. So we do a number of trainings. The core of what we do is our peer specialist training, called CARES, and it stands for Certified Addiction Recovery Empowerment Specialist.
The Georgia Council of Substance Abuse is an organization that I was introduced to 2 years ago through their CARES Academy, which means that people who are in long-term recovery acquire a certification to be able to work with our peers. The CARES Academy is 40 hours of training, and so we are just trained in the model of recovery as individuals who are in recovery view it, as well as from the medical side.
We've been able to train 500 peers to date. We have as many as 90 applications for a class of 20. And so this has really, really caught on. People want to do this work, especially, recovery has a huge tradition of giving back, and I think people see this as a way, let me get some specialized training so I can give back to my community, I can give back to my family, and give back to my agency.
Being a peer support specialist empowers me on my own journey in recovery and provides meaning in my life by enhancing my recovery. I never dreamed that the darkest places in my life, the scariest places that I've been, would turn into a way to reach people and a way to relate. It's pretty magical.
This training was different from becoming a certified addictions counselor, but in that I was able to use my lived experience, and that is the key, that it had value and it had purpose. So everything that I went through before, everything that brought shame and guilt, was the very thing that I can use to help somebody else.
I didn't know of any 800 numbers that weren't attached to a treatment program. So I said, why don't we do that and do a demonstration project we can work with the Department of Corrections, we can work with drug courts, we can work with jails, we can work with treatment programs. So anybody who gets out can have an 800 number where they can call or text and just get a hope shot.
The CARES Warm Line is a non-clinical, non-emergency telephone and text support service that's available for people in recovery or seeking information about recovery. It's manned by recovery coaches with lived recovery experience.
If you're struggling with addiction, if you're seeking recovery, if you're a family member, we're just going to listen to you. We call it radical listening. We're not going to try to fix you. We're going to hear you. We're going to listen to you. We don't talk about this enough. And again, that's the mission. That's what we do, is we say, let's talk about it. Let's bust some of the myths around addiction. Let's take it out of the shadows. Let's talk about it as a preventable, treatable, chronic health condition, and that people do recover, because we don't get that message enough.
My story is yours. I am a mother.
I'm a father, a son,
a daughter. I am in recovery from a mental illness,
a substance use disorder.
with support from family and community.
We are victorious.
Join the Voices for Recovery. Our families, our stories, our recovery.
For confidential information on mental and substance use disorders, including prevention and treatment referral for you or someone you know, call 1-800-662-HELP.